decided that this is the right decision for right now here in Ontario. While individual hospitals can make their own determination, we had to really do a risk assessment, taking a look at the answers that we received from the many groups that the Premier sent the letter to, as well as what's going on the ground in other jurisdictions. And we know that in British Columbia, for example, they've had to cancel some of their scheduled surgeries because they've got about 3,300 workers that are out on leave now and are being requested to have vaccinations. And Quebec has just announced that they are taking another look at their original mandatory vaccination policy. So we took a look at that and the concern that we had that we would lose some of our precious health human resources compared to a relatively small number of outbreaks. And that's why the determination was made not to proceed with a mandatory policy at this time, although we're continuing to watch the numbers every day, and we'll see what happens as we go further into the winter. We heard from different groups, depending on where they are in the province of Ontario. Some places are really struggling more with health human resources than other areas. But that's one of the primary concerns that we needed to take into consideration, because we don't want to have to cancel surgeries in Ontario. We've been very fortunate that we've been able to keep those surgeries going, even though we still have thousands of people that are waiting for those surgeries for hip and knee replacements, which are painful for people, prevent some people from being able to work, cataract surgeries and so on. People have been waiting long enough, and so as government, we have a responsibility to protect the health and well-being of all Ontarians. And so that's why this decision is the right decision for Ontario right now. Well, that was a number that was based on the Premier's understanding of the situation before the letter was sent out. We know that there would be some significant job losses if we were to proceed with mandatory vaccination right now. But we still support the decisions of individual hospitals to do as they see best. And I would really point to some of the pediatric hospitals for that, because they are dealing with very vulnerable patients that don't have the opportunity yet to be vaccinated, although we hope that we will receive approval from Health Canada very shortly for that. It would be very significant. And that is why we want to be able to maintain our health human resources so that we can care for the people with COVID, of course, but also care for all of the other people who've been waiting for surgeries. And we've got thousands of surgeries that are waiting, not to mention diagnostic procedures. And we know that what we're seeing in our hospitals right now are patients that are more acutely ill, because to some extent we've had to postpone some of those diagnostic procedures. We want to be able to keep those going so that we'll be able to treat people in an earlier stage of an illness so that they can become well. We're certainly not saying that. We have been urging everyone in Ontario, particularly frontline healthcare workers, to please go and get vaccinated. We've said that from the beginning. We will continue to say that. That's the best way to protect individuals, families, and communities. But in that situation where there are some who are not being vaccinated, we still have very rigorous testing procedures there for the protection of their patients and the families that come in, that they will need to undergo a rigorous PCR testing to make sure that they are healthy and won't transmit COVID to any other patients. What I would say is that from the beginning, the health and well-being of all Ontarians has been our priority, and it continues to be. And so it's the patients that we are protecting by having the employees tested frequently for COVID, but also for the thousands of patients who have been waiting for well over a year to have procedures done that are painful and debilitating, hips and knee replacements, cataract surgeries and other surgeries. We want to make sure that we can move forward with that, because while it's terrible to lose someone from COVID, it's also terrible to lose someone from something that hasn't been diagnosed early enough or hasn't been operated on soon enough. So that is why we're taking the entire population.